Hey everyone, welcome to my YouTube channel to teach. Today we are going to talk about unfavorable scales of malocclusion. Correct tooth position is an important factor for aesthetic function and overall preservation or restoration of dental health. While most malocclusion may not adversely affect the health of an individual, they nevertheless are capable of producing undesirable functional and aesthetic imbalances. There are some of the important unfavorable qualities of malocclusion. We will enlist them first and then we will discuss them one by one. First one is poor facial appearance. Second is risk of caries. Third is it malocclusion predisposes to periodontal diseases. Fourth is psychological disturbance. Fifth is risk of trauma. Sixth is abnormalities of function. And seventh is temporomandibular joint problems. So now we will discuss them one by one. So starting with the first one, that is poor facial appearance. Malocclusion is capable of adversely affecting the facial appearance of an individual. As you can see in the picture, when a person smiles, or even though when the person is not smiling, the malocclusion can affect the facial appearance, and if there is malocclusion is where it can cause poor facial appearance. Going towards the second unfavorable quality of malocclusion, that is risk of caries. Malalignment of teeth makes oral hygiene maintenance a difficult task, thereby increasing the risk of caries. It may also reduce the potential for natural tooth cleaning, thereby increasing the risk of decay. Here you can see in the diagram there is malocclusion, and this malocclusion not only affects the patient's ability to clean the tooth, but it also reduces the potential for of natural tooth cleaning system, and thus increase the risk of caries and decay. And there you can see there is lot of plaque accumulation. The yellow area on the tooth shows the plaque accumulation, and it is because of malocclusion. And here you can see the spots of calculus, and it is because the tooth is behind and it is not in alignment, so the brush and is not able to reach there, and also there the potential for natural tooth cleaning is reduced, so the risk of caries increase. Going towards the third unfavorable quality of malocclusion, that is, it predisposes to periodontal diseases. Malocclusion associated with poor oral hygiene is a frequent cause of periodontal diseases. In addition, teeth are placed in abnormal position can be cause for traumatic occlusion with the resultant periodontal tissue damage. Crowding can cause one or more teeth being squeezed buccally or lingually out of the investing bone, resulting in reduced periodontal support. Traumatic overbite can also lead to increased loss of periodontal support, and therefore are another indication for orthodontic treatment. There you can see there is periodontal diseases and the bone is lost and the teeth are so mobile, and like the bite is, you can see also see the bite, this is traumatic bite, and it can further enhance the problem of periodontal diseases. Going towards the next or fourth unfavorable quality of malocclusion, that is psychological disturbance. Malocclusion that adversely affects the appearance of a person lead to psychological disturbance. Unsightly appearance of teeth make a person highly self-conscious and turns him into introvert. Thus, treatment of malocclusion in such patients help in improving the mental well-being and confidence. Fifth unfavorable quality of malocclusion is risk of trauma. Teeth that are severely proclined are at high risk of injury, especially during play or by an accidental fall. There you can see a case of incisor trauma of incisor, and this is due to malocclusion. Seventh, unfavorable sequelae of malocclusion is abnormalities of function. Many malocclusion cause abnormalities in the function of stomatognathing system, such as improper deglutition, defects in speech, improper respiration, etc. These all things can be caused by malocclusions. Seventh important unfavorable sequelae of malocclusion is temporomandibular joint problem. Although the link of TMJ problems to malocclusion is not that much experimental, but most of the cases in case of malocclusion it leads to temporomandibular joint problem. Malocclusion associated with occlusal prematurities and deep bite are believed to be cause of TMJ problem, such as pain or dysfunctions. Because when there is deep bite, there is increased force at temporomandibular joint area, and thus increase the risk of pain or temporomandibular diseases. And so therefore the occlusal immaturities, because when there are occlusal immaturities, there are excessive and frequent pressure on the TMJ area that leads to pain at that area. So there is link between temporomandibular joint problems and malocclusion. These were all the unfavorable sequelae of malocclusion. Don't forget to like, share, subscribe and comment, and thank you for watching our video.